All right, so next we have Jo Dawes, who will be presenting on PPIE with people who have experienced homelessness, informing a qualitative study about COVID-19 impact. Jo, when you're ready.
Hi, thanks. I'd like to share a bit of an experience through my research journey using PPIE. A quote here: "Our life experiences shape us into who we will become." So I'm going to tell you a bit of a story. I'm a physio by background. I worked for many years in Glasgow with people experiencing homelessness. And this time in my clinical career with the NHS really made me feel passionate about the care of people who were experiencing homelessness and how important it was that they could access good healthcare whilst their health was so poor. So in 2017, I applied for NIHR funding for a doctoral research fellowship, and part of the application process was to undertake PPIE. Thinking I knew lots about this population and that maybe this was just a process I had to go through, I undertook my PPIE. I reached out to a health organisation, a charity called Pathway, who support people with experience of homelessness through their Experts by Experience programme. They helped me to reach people who were homeless at the time, which I no longer had contact with because I was working in a university by now. So I was able to run a PPIE session with people who lived on the street, or lived in hostels or at temporary accommodation. So they were able to be brought to a central point in London where I met them, I provided food, and we were in a safe space where they could share their stories. It was a really fruitful day, and I got loads of information that informed my recruitment, my study design, how I would disseminate information. And I wrote up my PPI statement, feeling well corrected that this was far from a tick box exercise. I unfortunately wasn't funded for the DRF that I had applied for, but I was highly commended for my PPI, and a colleague that worked with me on it kind of was really encouraging, saying you should write this up for publication. Needless to say, I was busy and I ignored him. So come to 2020 and the pandemic, and I had started a pre-doc fellowship again in an attempt to try and get a DRF, and I had started just as the pandemic hit. We were all remote working, and I revisited the idea that maybe I should write up my reflective piece for publication. So I went back to the Experts by Experience that I worked with, and we together reflected on the experience we had had when we'd done our PPIE, and a paper has now been published. So again, come forward to last year, I was working as a qualitative researcher on a COVID social study and finalising my PPI for my doctoral research fellowship application. Being able to connect with the people that I'd connected with before, I was able to use an advocacy organisation who supported people experiencing homelessness to use online technology. And so coming back to my quote, how our life experiences shape us into who will we become. The people who've experienced homelessness have amazing, powerful, sometimes very challenging experiences that make them excellent informants for research that's going to be about them. But also I, as a researcher, have grown hugely by being able to undertake PPIE, and it has helped me grow to be able to be a better researcher and have better research in the future. Thank you.